The last type of dementia that I'd like to talk about is called Lewy Body Dementia. And so this seems to be it seems to be more and more prevalent in our society. And some say it's now the second most common type of dementia. Alzheimer's disease is the most common type. It's typically been thought that vascular dementia was the second most common type. But Lewy body dementia seems to be on the rise. And so up to a quarter of all dementia cases now might, in fact, be Lewy body dementia. And so with Lewy body dementia, you still have the same memory impairments, aphasia, apraxia, agnosia, but you also have other symptoms as well. And if you have two, you have to have 2 out of 3 of these symptoms. And so the first would be, we'll say, visual hallucinations. And then the second is Parkinsonism. And then the third is, I'm going to put, it's fluctuations of consciousness. Okay. And so with the visual hallucinations, what will happen for people with Lewy body is they will see fully formed, detailed images that aren't there. And commonly it's like children or animals like cats, or it'll be like little figurine people, or it can be anything. But what's important to know about the visual hallucinations is that they are as clear as day. So it's not, sometimes in schizophrenia or bipolar disorder, or sometimes in other mental illnesses, they might say, you know, I see things out of the corners of my eyes. I see shadows, or something kind of vague. In Lewy body dementia, they see a person standing right in front of them. They see them there. And so this can be frightening. On the other hand, a lot of times the visual hallucinations aren't frightening. They're very benign. And so, you know, we'll ask people, you know, do your eyes ever play tricks on you? Well, no, I don't think so. Okay, so you never see like cats or dogs or anything like that. And they say, oh, well, you mean that cat right there? And there's no cat there. Or what they might do is they might, you know, they'll go to the kitchen and they'll get some, you know, they'll bring out 3 Cokes, and they'll bring a Coke for themselves, a Coke for their wife, and a Coke for this nice little girl that's sitting right down on the floor by them. And it's just as clear as day. What's interesting about the visual hallucinations is that, at least in my clinical experience, what I see is that they don't talk. They don't have auditory hallucinations. So you won't see them necessarily having conversations with the hallucination. And so it's purely visual. It's not auditory. In schizophrenia, for example, the problem with schizophrenia is the auditory hallucinations, right? They hear voices that aren't there. They don't necessarily see things that aren't there, although they very well could. So that's visual hallucinations. For Parkinsonism, Parkinsonism is like Parkinson's disease. A lot of times in our Lewy body patients, we might not see kind of the classic pill rolling hand tremors. Usually the Parkinsonism is more subtle. So for example, they might have what's called cogwheeling, where if you move their arms up and down, you kind of get this ratcheting effect. So they have this motor stiffness, and their gait is very Parkinsonistic. They kind of shuffle along. They'll have the kind of the masked faces, or kind of this poker face where they kind of lose their facial expressions, and they're just very, again, just without any affect in their facial expressions. So that would be Parkinsonism. And then finally, it would be fluctuations of consciousness. And so for fluctuations, a lot of times, for my patients, what I'll do, or for the caregivers of my patients, is I'll ask the caregiver, you know, does your loved one ever have spells? And there's kind of 2 answers that I'll get. I'll get, well, what do you mean by spells? And if I have to explain what a spell is, then the answer is no. And so, however, for a lot of them, they say, oh yeah, they do have spells. And so then I'll ask the question, well, what do you mean by a spell? And then the answers just vary widely. And so it can be anything from kind of the classic sundowning picture where the person is essentially fine during daylight hours, and then around 3 or 4 in the afternoon, maybe a little later, they become more confused and more disoriented. Their personality just changes. It might be that they have spells from week to week and not every day, but in some way they have their consciousness it fluctuates in some way. And so this without a doubt is the loosest of the 3 criteria. It's the one that's hardest to get at. But nonetheless, if a person has 2 out of 3 of these criteria, then they would meet criteria for Lewy body dementia. And then if you compare this to these clinical criteria to pathology, where you're actually looking at the brain slices after the person has deceased, having 2 out of 3 of these criteria, it's about 80% sensitive and specific to pathology, which is a really big number for simple criteria like this. So that would be Lewy body dementia.